Among the things that are unique to Ireland are the country's poets, its ancient and recent history, its industries, and its beautiful landscape. What Ireland has in common with many countries in Europe and the rest of the world is a growing population of older people, among which are many that are in need of professional help and support. In the framework of the independent project, the Alzheimer's Society of Ireland, in collaboration with Emergency Response Ireland, now offers an integrated service to support people with dementia and their family carers. Building on an existing Telecare service, a new case management portal was implemented that enables Telecare operators to collect all the information and actions related to an incoming call. By assessing this information, care staff at the Alzheimer's Society can see exactly where and when a client is using the Telecare, allowing advanced care planning as changing care needs become evident. Follow us on a visit to the people providing this service and learn more about how it changes their work and the life of the people they care for. The Alzheimer's Society provides its services from several offices across Ireland. We have visited the Society's office in northern Dublin and spoken with Joanne Brennan, one of the care coordinators, about the impacts of independent.
The main difference that we have experienced since it started is initially with Telecare we were relying on them to send us reports or incidents that happened with our clients. Now with the Telecare portal we can access that information directly and straight away, so there's no time lapse. We can actually review the care plans immediately. I suppose the main thing that helps the clients is we can see when their dementia is progressing or if there is a change in their care plan, because then we can implement new care plans to assist them in their activities of daily living or their social care needs. So there's no time lapse again on their care. It can be dealt with straight away. It's a huge impact on the family care because there's security and they also know that they're not alone. Looking after somebody with dementia is a very lonely and isolated place to be. So especially with care or older people, they know they have somebody there that they can rely on and call on if they are ever in trouble. So it's a huge security thing for them. Well, as I already said, we can actually see straight away any changes in the client or any needs that the client has. So we can contact the families immediately and address those issues. The other thing is our carers send in reports at the end of the month so we can match them up, and it's an overall care plan. So I suppose we have a more in-depth care plan for the client themselves.
The offices and call centre of Telecare provider Emergency Response are located in Buncloddy, some 80 kilometres south of Dublin. There we met Lisa O'Leary, one of the Telecare operators, and spoke with her about how people with dementia have special requirements when it comes to Telecare, and about what the impacts of independent are in her view.
Certainly when the calls come through, because the nature of the client's condition and whatever may be going on, we would have a procedure to follow. Mostly we would say that we would normally speak to clients, but there may be cases where we wouldn't be speaking to the client and there would be a certain protocol put in place by the family or carers, to allow us to be less intrusive with the client, and just to get on with restoring safety to the client. So we certainly would have immediate access to anything that we would need to know, in order to process the call and, deal with the situation. Well, certainly, the Alzheimer's Association now can see with the press of a button, how the Telecare packages they're coming into place, benefiting the clients. We would before have probably less information about the client's needs and specific individual plans that are being put in place. Now, when it's on screen immediately, we can see that. So it does allow us, to, I suppose, potentially do the best for the client when the call comes through, and as well as that, it does allow, we'll say, the Alzheimer's and the associations to liaison more, with what's going on as well, without having to, come through to us on a daily basis. They can see it certainly much better, for their own information.
James Doyle is the Director of Emergency Response. For him, independent is above all a way to provide a better service to his clients.
The web portal we have developed, which has been funded by CIP, has been of huge benefit to our company insofar as it has given us a unique selling point in the marketplace. We've already been approached by a number of NGOs and people within the public health sector who are looking for us to engage with them and repeat the work we've done as part of our project. This is the first time that would have occurred for our company, and obviously the benefits then are huge potentially for us. The obvious benefits which accrue to our clients are real-time dissemination of information. Previously we relied upon generation of reports, which was a little bit cumbersome and always retrospective after the event. The huge addition the web portal brings is real-time transmission of critical data of our clients. For example, the Alzheimer Society coordinators now have access to information on their clients 24 hours a day, and that's a significant advantage for them. All things considered, it's been a hugely positive experience for emergency response, and we're very pleased to have taken place.